All right, I'm going to call the August 10th, 2022 meeting of Cape Fear Public Utility Authority Board. I will be standing in for Mr. Porter today. He is had a flight canceled and is stuck, so hopefully, imagine that, right? And so your agenda is in front of you, but we first need to determine a quorum, and I need a motion to excuse Larry.
So moved.
Second.
All in, and West Quarter, I'm sorry, both of them. We have a motion and a second to excuse both of them. All in favor say aye.
Aye.
Opposed? All right, your agenda is in front of you. If there's no questions about that agenda, I need a motion to adopt it.
So moved.
Second.
All in favor say aye.
Aye.
Opposed? All right, now the approval of the minutes. Mr. Hackney.
The July minutes are in the packet. Need a motion to approve?
So moved.
Second.
All in favor say aye.
Aye.
Opposed? And Donna, do we have? No public comments. That moves us quickly to our consent agenda. There are 4 items on the consent agenda. If anybody has questions, yes.
I have a quick question on item number 1. It's probably, not a fly in the ointment, I don't think, just trying to get a little bit of background on the chlorine building that we are deciding to replace instead of to upfit to utilize as an office. Do we have any financials on that, on what we look, basically a cost benefit analysis from upfitting it and utilizing it as an office versus building a new one for $500,000?
What's your preference, to take questions on the consent or pull it off of consent?
We can pull it off.
We can pull it off and then have a discussion. So items, do I have a motion to approve items 2, 3, and 4?
So moved.
Second.
All in favor say aye.
Aye.
Opposed? And now we can address number 1.
I knew I liked you. Mr. Frank Steyer can answer the question.
Yes.
Sorry.
Thank you.
Thank you. We did go through an evaluation of what it would take to convert that existing chlorine building down the south side that's no longer being used to store chlorine cylinders and such as that.
Go ahead.
There's a lot of equipment in there, and because of the electrical upgrades that would be required for, to air condition the building, a lot of the electrical would have to be replaced. We found we were better suited to go ahead and build a second building right next to it. This building is going to be a prefabricated building. It's going to come on a truck, concrete. They'll pour a slab, erect the slabs, and then outfit it. So that was it was actually going to cost more to upfit the existing building. We're going to take the equipment out of the existing building, pour a new floor in there, remove it, and use that more for a warehouse facility.
Yeah, and it looked like there's about $57,000 to get it to where we can use it as a warehouse.
That's correct.
Right?
That's right.
And then we're spending about a half a million to build this new building.
That's
but
right.
Do we have any idea what it was going to cost to just upfit and utilize it as an office?
It was going to be a couple $100,000. Probably a little bit less, but we wouldn't have the warehouse facility site.
Understood. Okay.
Frank, would you like to discuss how this integrates into the replacement project?
Yes, this area for both the warehouse and the new maintenance facility are sited so that when we expand the plant, we're going to begin that in 2025 is when we have funding to begin that plant expansion, and then it'll probably take until about 2030 until it's completely expanded, but this footprint for these 2 buildings will not be impacted. So we'll be able to keep our centralized maintenance staff and equipment here while we're building the upgrade, constructing the upgrade.
And as a reminder, that's both a plant expansion and a replacement for a facility that's now at its end of its useful life, and maybe one of the most important projects that we have on our portfolio in the next couple of years, if not the most important.
I appreciate that.
Yes, sir.
All right, you want to move number one?
So moved.
Second.
All in favor, say aye.
Aye.
Opposed? All right. Thank you. And that brings us to our new business. First of all, under our administrative reports, our attorney's report.
I did not have anything this morning.
Thanks.
Thank you, Linda. And executive director's report.
We bring to you the key indicators report, the environmental report, and the safety reports. In addition, I would like to add an item in terms of reporting out after we take any questions on those first three items. Are there any questions on the first three items?
Chair. Okay?
Yes.
Yeah, thanks. Ken, just one real quick comment on page 66 of my packet about the Sweeney Plant Weekly NPDES report. There's a major uptick in the pH values. Is there something driving that, or is that any cause for concern?
Carl, do you have any thoughts on that?
That particular uptick on page 66 for the pH, it was a one sample event. The follow-up samples did show to go down, and for the day we were in compliance. It had to do with mixing. When they took the sample, there just hadn't been enough mixing that had occurred at that location. But for the whole day, we were in compliance.
Oh, great. How come you didn't adjust the little notice on the graph then? Yeah.
Well, we have to report the highest number.
Ah,
That's by regulatory statute.
thanks, Carl. That's all I had. Thank you.
Okay.
So with your permission, Mr. Chair, the item I wanted to add in my report was that from time to time, we're approached as an organization to participate in university research projects. And we've been approached by both the Water Research Foundation and separately by the University of South Carolina to support a research project that EPA is currently seeking proposals for. The research project would focus on the occurrence and concentration of opportunistic pathogens and unregulated disinfection byproducts in the drinking water distribution system. We committed as staff to come back to you whenever we're approached for a request like this, because it has potential ramifications, which we experienced in real life in 2015, 2016. We do support the requests that are coming from these two entities, as we believe that it will be value add to our organization to better understand our water distribution system. The information that we will be providing will be anonymous in terms of reporting out, and we will follow the study very closely, and if any unanticipated impacts are discovered in our water distribution system, we'll immediately inform you, and we'll develop a plan to address it through water quality flushing and water quality monitoring. With that being said, I'd like to get a sense from the board if there's any concern about us participating in this research.
Ken, two questions. Refresh me, what happened in 2015-16?
It was the research project with Dr. Kanofsky.
Well, yeah, I thought Gen X didn't hit till 2017.
But this is exactly how it started, with
I
the
see,
request
okay.
for sampling through Canopy.
Good. Great. And is this being driven by COVID or what?
Carl, would you like to speak to any of this? While Carl's doing that, I would share my impression that this is driven by our community, our water sector community's desire to better understand our water distribution system. So we do research like this all the time. Carl, thoughts?
It is not driven by COVID, Commissioner's Apple. It's driven by, doing research to identify future regulations, if you will. So it's looking at unregulated compounds that EPA may regulate in the future. And I think in a project like this, typically will be, I think in this one I saw 50 or so utilities from across the country that would be participating to provide support to the research team.
So, PFAS.
No, this is disinfection byproducts and Legionella.
Ah, interesting.
Who's doing the research again?
Right now, they're in the proposal stage, and we have been approached by the Water Research Foundation, which is supported by, I believe, the University of Colorado, and then also a separate team approached us with the University of South Carolina with Virginia Tech.
Carl, we're just doing it on the distribution, we're not doing it on the wastewater?
This is for drinking water, correct?
Just for drinking water.
I do have one question. I know at the Board of Health, we get a report, and I guess that we're working with the Board of Health, and they're looking at wastewater and comparing COVID in there. How does that happen? I guess they're showing some data showing an uptick in COVID in the wastewater.
Correct.
Water.
And we are participating in that CDC project, and every week we sample the influent for our wastewater treatment plant at Northside. And then it's analyzed by others for remnants of the COVID virus. And it shows some very interesting trends. And then the health department correlates that with the number of cases that are reported at the hospital. And you see some very good correlation as well as pre-indicators. It's great research. I'll be happy to send you the link where the data is housed by DHHS.
Could you send that to me too as well?
Sure.
Thank you.
That's it.
So just for the board's memory, after we did a deep dive after Gen X on what we could do going forward, and one of the actions was if we ever got a random sampling request, we would make sure that the board approved it before we went forward. So that was one of the actions we specifically took. This is a perfect example of that. So
Great.
just FYI.
Thanks.
I believe that this is appropriate to respond as your staff and suggest that this is good long-term both for the industry and for ourselves. But we may discover some things that we need to react to. And we're prepared to do that. There are known activities to improve water quality in water distribution systems that we would undertake immediately. And then you are adding advanced treatment technologies to your primary treatment facility that many folks don't have. So that's yet another way that we can address anything we might discover. So are there concerns of it? I couldn't find a written policy on this, so I'm unsure whether this is a confirmation through assent or whether it's a vote of the board. Ms. Adams, do you recall?
It was not I don't believe it was a vote. It was just to inform the board.
Yes, yeah. I
It's-
think it was too, as I recall.
It was.
So are there any concerns around the table with us pursuing this with the caveats and the cautions that we offer?
I don't have a problem with it at all.
Yeah,
I mean,
again, how could there be concerns? I mean, my God, isn't this just trying to get ahead of the curve?
We think it is, but we also, that we as an organization had a difficult experience with a similar request. So I'm seeing assent through the board, or consent through the board, so we will proceed with agreeing to support this research. And we'll report it back to you. And that's it for my.
Let me ask the question this way. What would be the worst case scenario? What's the worst thing that could happen?
Don't say that.
what we don't know, right?
Yeah.
Yes.
Yes, well, we could discover that we have some areas of improvement in water quality for our water distribution, and then we'll have to react accordingly through additional flushing, maybe some change in the way we replace our lines if it's associated with the age of our infrastructure.
Things we're already working on, right?
Ken, when you refer to there was an incident that was somewhat negative, you talking about the ASR?
The Dr. Canopy's research there was a feedback and actually a report that Ms. Adams helped author that led us as staff to recognize that we need to keep you informed when we participate in these activities.
Yeah, okay,
And this is just a fallout from that.
I see, okay.
Okay.
Anything else?
No.
All right. We move on to committee reports. Executive committee met on August 3rd. The minutes are in the packet. And one other item under that is the election of the 2023 officers. You do have that slate in front of you, and Commissioner Zappel, as a representative of that committee, is here to present the slate of officers for 2023.
Thank you very much, Mr. Chair. I'd like to bring forward the slate of Jennifer Adams for chair, Wes Corder for vice chair, Jessica Cannon for secretary, and Mr. Bill Norris as treasurer.
I move the slate.
Second.
All in favor say aye.
Aye.
Those opposed? All right, thank you very much. And Jennifer, I'll turn it over to you.
Sounds good. All right, next up on the agenda is the Long Range Planning Committee.
Yes,
Okay.
so Larry's obviously not with us today. We had a great presentation about some infrastructure reliability and other issues within the strategic business plan. All those minutes are obviously contained in the packet. We also talked about the lock and dam update. Looks like that's all on ice. The feds have got us covered for now. More information is in there if you need it. And then we also discussed Sweeney, which I'm not sure if we're talking about today or not. Okay, so that's a different part. Okay.
Any questions, comments? Okay. Moving on to Finance Committee, Mr. Norris.
Certainly. The minutes of our meeting on August 3rd are in your packet. And if there's no questions, they're there for you to review. And I'll turn it over to John McLean for a monthly financial report.
Good morning.
Morning.
So here we are. We have a full year for FY22 to report. Now, these aren't final numbers. We're still closing out the fiscal year, but this is a pretty good idea of how things are going to end up for FY22. So you can see that our total fund balance here in, this is line 16, is about $100.5 million. You can see these different designations. We have about 13.1 that's out there in our debt service reserve. That's how we pay, or the source that we pay our principal and interest on our revenue bonds from. We have about $16.3 million in unspent bond proceeds. We have $58.4 million that was parked out there in November of 2019 for the Sweeney upgrade project and also for the raw water line transmission main that we did in partnership with Brunswick County. We have about $2.7 million in capital reserves. Those represent surpluses of prior years that we have set aside to provide a funding source for capital projects that we otherwise would have had to borrow for. And then I'll skip down to this section right here. This $1.1 million represents monies that were set aside that we got from the county and from the city at inception based on an actuarial report. We are obligated to provide post-employment healthcare benefits for city and county employees that came over upon inception of the authority. And that balance has been spent down from, I think, around $4.5 million that we got back in 2009 down to that about $1.1 million. So this other piece right here, this $11.8 million, that is our amount that we is committed for capital projects, and that's a key funding source for our capital financing plan. So around $11.8 million, just to give you a little context there, as of June 30th, there was around $18.5 million in outstanding contracts, so encumbrances, that will be funded with PAYGO dollars. So to kind of say that another way, our PAYGO funded contract commitments of around $18.5 million are around $7 million more than what we have set aside to pay for those commitments as of June 30th. Now, again, that number is always moving. On July 1, you're going to have another, well, this year it's $13.8 million that kicks in, but you have new appropriations. And I think the PAYGO appropriations were somewhere around $26 million. So what that basically demonstrates is that we're managing these PAYGO funded capital projects in a more or less lean and efficient way, where we're not waiting for the actual dollars to be there in order to fund those commitments. We're really doing it on a cash in, cash out basis, on a cash flow basis. So the goal is to get this number down, more than that. But again, this is a key piece that we factor into our 10-year capital improvement plan and how we're going to pay for it. So last but certainly not least is this unassigned fund balance. Our target here is $50 million. The excess, or the amounts that are above or below that, represents a true operating surplus or deficit. So what it's looking like is that we're going to have a surplus, an operating surplus of around $5.5 million for FY22. That is due almost exclusively to some revenue outperformance, so revenues being higher than what we factored into the budget, and that's really a product of moving to monthly billing. What you have is when we were under bi-monthly, you had half of our customers' June consumption wasn't billed until July and maybe even early August, so the next fiscal year. Well, we had that, okay, going from 21 to 22, but what you have at the end of FY22 in June is everyone is getting a monthly bill. So we basically have another month's worth of charges that are factored into this fiscal year. That's just kind of like a one-time, timing, difference that's attributable to that move to monthly billing. So, again, our uses in policy for, the surplus, there's a menu of options to choose from. Each of those is designed to reduce our recurring costs, which, in effect, gets rebated back to customers, meaning that rates don't have to be as high or as they otherwise would have been, right? So, those uses are, pay off debt early, set it aside in the capital reserve to avoid having to issue debt. And so customers aren't having to pay the interest on that additional debt. Or it can go to supplement this little OPEB fund here, because once that money runs out, that means we are obligated to provide those benefits to those city and county employees that retire with us. When that money runs out, that means that those benefits have to be baked into what we recover, from our revenues during the year, and all things being equal rates. Any questions?
What's the rate the OPEB is dropping? You said it was in 2009 it was 4 million. Now we're down to 1.
Right. So
has it been dropping more drastically in the last few years?
Well, I think what we've seen is that the healthcare costs that were factored into that actuarial study that was done back in 2009, we've seen actual experience be a lot higher. We have about, I'd say about 2.5 to 3 years worth. We're seeing a lot of those employees starting to retire. It's kind of ticked up in the past year, and we're going to continue to see that over the next 2 to 3 years. So that's a very, I guess, real concern. Our actuary projects for benefits, I think, to be the last year that we're projecting to have to pay benefits, I believe, is 2042. So just to kind of give you some context, this will last us 3 years, but we have to pay benefits probably through, around 2042, 2043.
Think everybody will be dead by then or something?
No, I guess that would be one way. Yeah, sure, but no. So we mandate that. So part of the plan provision is when the participants become Medicare eligible, when they turn 65, they get transitioned, from this plan and they pick up Medicare coverage. So it's those employees turning 65.
Oh, you knew something we didn't.
Yeah.
I'm glad to make you smile a little bit.
But if I'm not mistaken, the last projection is we're about 4 million short in that pot, correct?
Yep.
John, I know when this came up in finance, there was some discussion about the responsibility. This was a decision that was made, or a commitment that was made by the city and the county back in 2008 when we consolidated. Have there been any discussion back with the city or county to handle this obligation? In other words, why should ratepayers, our current ratepayers, be responsible for this decision that was made by the city and county at that time? If they short-funded it, which they didn't do intentionally, but that's what's happened, shouldn't they be held responsible, the city and the county,
No way.
to maintain that?
Yeah, and that's a fair way to look at it. But to answer your question, to date we have not opened those discussions with the city or county.
Well, I would think that the city and the county would be insulated from that.
You can make that argument as well. That there was a study that was done. That liability got transitioned to this group through the ILA when we were formed. And I think that's probably the argument that you would hear from the city and county.
But again, if it's short funded, the liability is still there. They just didn't put enough money into it. And now, a responsibility is a responsibility. I think it's worth a discussion.
Yes, sir.
John, I hear you. I know the reality is they're going to put a brick wall up and say, no way. That was, back then. Now it's today. But I just don't know it's fair to our current ratepayers to be held responsible for that decision.
Sure. Ratepayers or taxpayers? Which one? Some payer gonna pay it.
No, I hear you, but
Well, this authority wasn't born overnight. I mean, it was a lot of teeth gnashing and angst and everything else. And I mean, I think they did a whale of a job the way it was structured. And here it is, we're turning over all of our assets, lock, stock, and barrel, take it and go with it. Did it start off smooth? No, but I don't think this is something, I mean, of course, then you got to get the county and the city to agree, because one can't say I'll do it and the other says no.
Fair point. Yes, sir.
Another topic. Now that we've kind of reworked the reporting, and we now at 55 million. Thank you, John, for working that through. And we pulled aside the amount of money that we're going to hold amounts assigned for capital projects, and kind of pulled that out of the whole thing. We end up with $5.5 million of essentially profit at the end of the year. Talk me through your thinking is why couldn't we use that to reduce for this year only, not in the future, this year only, the amount of increase in rates?
Sure. So there's kind of two ways to use surpluses, right? So surpluses are a one-time funding source, right? Once that $5.5 million is gone, it's gone.
Right.
Okay? It's never coming back. So best practice says that ongoing expenses should be funded with ongoing revenues, and that one-time revenues, non-recurring revenues, generally should not be used to fund ongoing operating costs. So the concern is that if you take that $5.5 million and freeze rates where they are, or even reduce rates, okay? Once that money is out, all other things being equal, rates are going to have to jump back up. And so let's say that buys you 2 years of leaving rates stable. What that's going to do is it's going to present this board with a difficult decision in, let's say, 2 years, where instead of being faced with a 1% or a 2% or maybe even no percent, you're going to be faced with having to raise rates something higher. So it's just a consequence of using those one-time revenues to fund those recurring expenses. So kind of what we have in policy, those uses, what that's really designed to do is reduce the recurring expenses, which is a more sustainable way to bring rates down.
How much does an 8% rate increase represent?
In terms of
Dollars.
it's about $8 million,
$8 million.
$8 to $9 million.
Of increase coming, into our coffers.
Yes, sir.
Right, so if we took 5.5, that would reduce that 8% down to 3%?
Sure.
4%?
Mm-hmm.
And we've set aside other money already for, assigned for capital projects in the future here that we already have. That's the $11 million.
Right.
So some of that recurring cost is already covered through that $11.8 million.
Well,
The potential, yes.
Well, the recurring costs that we're talking about is all on this side. The use of that $11.8 million here is driven by this side, the capital side.
And we just discussed $4 million that could very real could be a reality to us in the next year, having to fund the OPEB.
OPEB, 3 years.
3 to 4 years.
Right.
Right.
And go ahead, Ken.
Well, I shared this with the Finance Committee, and we've talked about it multiple times in long range. I think it's important as the Executive Director to kind of reinforce this. Over the next 10 years, we have a capital improvement plan of $512 million roughly. 29% of that is one project, the Southside Wastewater Treatment Plant. We have it programmed at $153 million for what we think will be maybe a 16 MGD facility. We are working hard to update those cost estimates, which we have brought forward from 2013. We are aware as your staff that there's one other wastewater treatment plant under construction in North Carolina today. There may be others, but we know of one. That's the Stowe Resource Recovery Facility in Charlotte. 15 million gallon a day plant. The maximum guaranteed price for that has been reported at $300 million. The Southside plant is critical not just for continued growth in the community, but even if we didn't grow at all, we would need to do something with that facility because it's exceeded its useful life. So we're worried, I'm worried, that there's a delta there. We'll discover what that delta is in a couple of months. And my advice would be to manage funds that we have to try to address that delta first. But I recognize that there's a lot of other policy issues to be discussed.
Ken, if that's the case, and very realistic, then why don't we take that $5.5 million that we have here that's above our stated policy and put it into unassigned capital projects?
And that's what we're likely going to recommend. That square up happens once a year. So what we do is we wait for the entire year to happen, closed out, audits done, so we have a good final number to report, and then we will recommend from that menu of options that's in policy for you to consider. And that will likely be what we'll recommend is that $5.5 million go into a capital reserve for the Southside project.
When does that happen? September, October?
It's generally happened at the November meeting. We're required by statute to have the audit filed with the LGC by October 31st. So it generally happens in November. It may happen earlier this year, depending on the timing of when we can get the audit done.
That seems to me to be what you're saying, it's the obvious thing to do. If we've got, is living, do we have a GMP on the south side yet? We don't. It's gonna be huge, yeah. All right.
Now, I would reinforce that these are separate plants, separate site conditions, separate receiving waters. This is only a qualitative analysis. We'll do a quantitative analysis here shortly, and then we're going to value engineer that with another engineer to refine that number as much as possible. Carl, when do you think we can bring that forward?
I've been in contact with the engineering firm, and we can do that under your executive director signature authority, and we would have a result back in the November timeframe.
When?
November.
All right. John,
Thank
thank you. I'm going to recognize Frank to introduce Jeff Coggins, I do believe.
Thank you. There were two items reviewed at the Finance Committee that the committee recommended be brought to the board to be reviewed. The first is an update on the Sweeney Treatment Enhancements Project, and Jeff Coggins with Black & Veatch has been the lead engineer on the two most previous Sweeney expansion projects, including the one underway now, the GAC contactor facility addition. So Jeff's going to provide an update on the current status of the project.
Thank you, Frank. Thank you all for the opportunity to speak with you today. I am here to give you an update on the Sweeney GAC project.
Yeah, you need to stand behind the podium so they can pick it up.
Is this better?
Much.
Okay. I am here to speak on behalf or give an update on the Sweeney GAC addition. The project has received some further delays, and that's the purpose of the update, is to provide it with a focus on the schedule. So the project as it stands today is about 85% complete. Most of the, I call it the heavy lifting, is done. The concrete's poured, the masonry's up, the roof's on it. You can see in the picture the inside of it. It looks like it's fairly complete. The under drains are in the contactors, the gravel bed's in, and we just started in the last 2 weeks of loading those contactors with media and preparing the media for its final use as far as treatment. The project financially is in great condition. There has been a number of changes over the course of the project. I think there's 11 total. But combined, the amount of change, the sum of all the costs is less than 1%. So that is a huge testament to the staff and their ability to stay focused on doing the project and not adding other scope and other things along the way. So it's the project going financially very well. The challenge has been scheduled. So remains to be scheduled. The contractual completion date for the project, substantial completion date, is June. And here we sit in August, nearly almost 2 months, month and a half later, talking about it not being done. So I mentioned having a number of cost-related changes. We also have had a number of schedule-related changes that's been issued by change order. The sum of all those is around 134 days. It took the original contract date of February of this year into June. The majority of that change is been in weather and in COVID-related activities or delays associated with COVID. And I will report that those COVID-related challenges are still present in the project today. But nonetheless, these change orders that's on the screen here only gets us to the June date that has already passed. We do still have quite a bit of work remaining. There's 8 contactors out there. As I mentioned, they started loading the contactors 2 weeks ago with media. 2 contactors are already full of media. 1 contactor has already been prepared as far as the rinsing and everything. We'll go through that a little bit more in the schedule, but one of the driving
portions of the schedule is loading the filter boxes and rinsing the media in preparation for use. One of those contactors has already been through the rinse process, so we're able to see the schedule and maybe make some better predictions on the schedule as that's already behind us. We are in the process of rinsing the second one as we speak. There's still a lot of other work going on. There's still a lot of electrical work left. Instrumentation and control work is still in front of us. The SCADA system is being used. We're using that now to control the rinse rate and backwash pumps and everything else associated with the contactors. But we're still going through a debugging process, and some of the less process critical elements of that SCADA system are still being implemented and integrated into that SCADA system. So those are probably the three largest items of work that's still in front of us that are driving the schedule right now. There still is training, and then after all the contactors are online, the operations team needs to be able to run the plant. We're calling it a functional test, but it allows them to run the plant in various fashions to prove out all of the items that are in place to function like they're supposed to. So it's a functional test or an operational test. Contractually, that's a 14-day period that we'll follow once the contactors go online. And there are some other things going on related to site work, paving, and that kind of thing that will also happen. Based on the schedule I'm getting ready to show you, the driver of that schedule is bringing on the contactors one at a time, going through the loading process, going through the rinsing process. The other items should be able to take place while those contactors are being loaded and prepared. So this is a pictorial of the schedule that we're currently following. Each of the golden arrows represent a single contactor, represents loading a contactor with media. It's a 3-day process, and then followed by rinsing and backwashing, and rinsing and backwashing the contactor to prepare the media so it's ready for use. As you can see, the string of those 8 contactors, each representing about a 2-week period at a time, makes the overall schedule to having all 8 contactors online towards the end of the year. I know this is a big change than what we talked in the past, but it is what we are predicting at this time as the most probable time that all 8 contactors will be online. As I mentioned earlier, I gave this presentation back in the long-range planning, and then again last week in the Finance Committee. We have two weeks worth of data that we're digesting, we're utilizing, and we're trying to refine the schedule a little bit more. 2 weeks ago, our success story was we finally got to where we can load the first contactor. That was a huge milestone. We were being delayed 2 and 3 weeks a month because we couldn't get to that step. And so 2 weeks ago, we made a great, even though we're delayed, we made a great positive step toward having more confidence in the schedule going forward. Today we sit here 2 weeks into that process, and we're slightly ahead of our current schedule. So that's promising. And we're going to continue to look for ways to improve that schedule as we go on, including the possibility of starting the contactors where maybe we're not starting all 8. We might be able to start in, say, a bank of 4 contactors and be able to get some beneficial use of them sooner. So I'm working with staff and with the contractor, and we're looking at options for improving this, but wanted to bring this forward to the board and make sure y'all understood what would be a probable path to getting all 8 contactors online as we saw it 2 weeks ago when we started this process. As I said earlier, after the contactors are online and operating, there is still quite a bit of work to do as far as proving out the SCADA system, going through the functional testing, and punching out the job. So we're predicting a final completion of the overall project in September of next year, but we'll have beneficial use of the contactors, hopefully of all the contactors before the end of the year. But again, we'll be looking for ways to improve that. So why is it delayed? First and foremost, it's the contactors and the string of contactors, one at a time, to get us to this process. One of the questions in a previous meeting, I think it was the Finance Committee last week, was can we not do these all at the same time or multiple contactors at the same time? We started out the process thinking they need to be linear, they all need to be done one at a time. The fundamental reason for that is the treatment of the waste stream. All the clear water waste from the filter backwaters, filter to waste, now contactor, rinsing process, all goes down to a wash water equalization basin on the property. It's processed water, but that water is our critical element. Treating that water is a critical element. Water's pumped to 2 clarifiers on site, and we've got to be able to regulate the flow to those clarifiers such that the water quality coming off those clarifiers are safe to recirculate back to the plant or discharge. So that has been the criteria by which a lot of the timing of these durations of rinsing is keyed on. We have been able to, again, the first contactor was done with a slightly less amount of time or less amount of water going down there. We've also been able to achieve loading the adjacent contactor with media while we have been rinsing. So both of those are things that have been favorable to our schedule since we started this discussion 2 weeks ago. So I just want to report that. The contactor loading and rinsing is still the critical path for the project. Other challenges continue is the contractors' labor and materials and the subcontractors. And COVID continues to be a culprit in that. I was on site this week and was notified, our critical path, non-loading of the filter boxes is the electrical, completing the electrical work. And I noticed there's only 2 or 3 electrical contractors on site doing work. And we found out by talking with them that 6 of the electricians have been out for the last 10 days due to COVID. So we have about 10 to 12 electricians on site working, and around half of those have not been on site for the last 10 days due to COVID. So that is continuing. It is an issue, and something we'll have to deal with through the end of the project. So in summary, our timeline is dictated, as we have currently shown, based on the contactors, the loading of the contactors, the preparing of the contactors, and we will continue to look for ways to improve the schedule. We are at a critical point in the project. For the last 3 years when I've been building this project, there's been some separation between construction and operating facility. There was always a seam here, the electrical wasn't connected, the pipes weren't connected. We're all connected to this point. The pipes are connected, all the systems are disinfected. It's safe, but we are trying to start up facilities and operate them in a zone where the only thing separating the new and the old is a closed valve or series of closed valves. And we're relying on SCADA to open and close those valves. So we are doing everything we can to accelerate and being ready, but I guess what I want to get across in this realization is we're trying to take all precautions necessary to make sure that what goes to the system is safe and reliable. That is our number one charge. I want to commend the staff at the plant for working in a construction site for the last 3 years with hard hats and safety boots and vests, and at the same time producing a tremendous quality water through the entire process. They've done a great job, and they are working diligent with us to make sure we are doing the right steps now in this critical transition. So I want to. That's all I have for today. Happy to take on any questions.
Thank you for this. You mentioned potentially getting 4 contactors live and working, and maybe bumping that timeline in order to bump that timeline back. If that happens, is there any worry that there may be additional stress put onto those 4 contactors? I don't want us to rush to get something done just because of political pressure, basically.
So couple of different questions in there, statements, and I'll try to address each one. As far as the timeline, if let's say we were able to get 4 contactors prepared and ready to go online, we're thinking that might be as early as, say, early fall. The demand of the system in early fall is somewhat less than 20 MGD. It's usually in the 16, 17 MGD range. 4 contactors, based on the design flow rate, is set up for 22 MGD. So we've got to balance that, what is the demand in the system and what can the 4 contactors reasonably, effectively do. But the magic number is 22 MGD. The other side of that is, as I mentioned, there's a bunch of electrical and INC and SCADA work left to do. And the schedule that we strung out to December allows time for all that to happen. As we bring that contactor startup date, say partial startup date, sooner, it starts making those other items more critical. So we're balancing when can we have contactors ready to operate in excess of what the demand in the system is, and at the same time, how do you balance that with where are the conditions of the electrical and the INC and the SCADA and the checkout and the training that also has to happen such that operationally they know they will have the tools to treat effectively at the time the contactors are there. So we've got our eyes on all of that. There's a lot of moving pieces, but again, 2 weeks ago we were thinking the best we can do is December. Now we're thinking there's options, and we're weighing those options, and we're trying our best to figure out a early delivery of partial delivery with an eye focused on safety.
Go ahead.
Thank you. Jeff, thanks again. I know we've spoken before. I appreciate it. You know, in summary, and I won't go into a lot of what we there, but I see it from our original completion date, which was in February of this year. We are now looking at a year behind schedule. Agreed?
Overall, yes.
What are, and you mentioned earlier on that, you know, we've only had, 1% change orders, throughout the process. But being a year behind, there are a lot of other costs that are kind of pile up, including Black and Beaches, which we are approving today, another $316,000 to keep you on the job there. What are those overall costs by being a year behind schedule? Do you keep that, or is that something that our staff?
That would be something that our staff would report out on.
I see. Do we have any idea what that is?
We extended the Black and Beach contract
Right.
to extend their contract to the September date that it currently is. That was about $165,000 plus the amendment we're reviewing today.
316.
That's correct.
So there's 400 and moving in on $500,000.
So that would be the yes, to Black and Beach. That's Black and Beach's expenses. Of course, we've got our project management, our team. There's an impact to our operations.
Right.
There's other things that are less tangible to quantify, but
It's cost us a bunch, a year delay.
yes, sir.
Not criticism, just saying it's.
It is a lot in perspective of the size of the project.
I'm just trying to keep a broad view of it. This is great news, what you're saying here, Jeff. I know from the original, I guess it was long-range planning when you brought this news to it. Frankly, I was pretty upset at that time. And what you said, now we have 2 weeks more, data. It's showing that it sounds like October, maybe, that we could get those 4 contactors on board. Yeah, I know you don't want to say it. I don't blame you on that, but that's, I'm a fairly sunny and optimistic person, and I thank you so much for really bird dogging what's happening now and really putting the pressure on. I know you leave these meetings and you go back and tell your people, we've got to pick up the pace. I got this jerk on the board here who's on my back. And so I thank you for that. And I'm looking forward to hearing as each one goes on. I know you pick up speed because there's techniques, et cetera, that happen. So thank you for that. I appreciate it. That's all.
Go ahead.
Are we advising our ratepayers or the general public of the setbacks or delays in this project?
Yes, sir. We will have a press release, and I'll be prepared to answer any questions that may come from that. We're also having conversations about doing direct mailings to the most impacted ratepayers, which were in the Sweeney service area. And then we're modifying our advertisement to be reflective of this new reality.
I just want to make sure that with this information and the information this gentleman has presented to us with the delays because of COVID, I think the public needs to know that we are moving forward with trying to get them some better drinking water, because we did just have a rate increase, and a lot of people out there are just saying, oh, they just gave us a rate increase, you're always going to hear a bunch of negative comments from ratepayers, but you guys don't ever get a chance to hear that. I do. So I just want to make sure the public and our ratepayers are being advised of the delay.
It's funny, they never come up and pat you on the back when we go 3 years without a rate increase.
I know. That's just like gas prices. Nobody says, oh, gas prices are low now, but that's how that goes. So yeah, that's my comment.
Thank you, Mr. Carter.
All right, we do have an action item that is associated with this request. Mr. Zappel already alluded to it, so I'm going to recognize Frank.
Thank you. And the second item that the Finance Committee recommended to be brought forward to the full board was a amendment. As Mr. Coggins just presented, the construction phase, the construction has been delayed. Construction phase engineering services with Black & Veatch expire September 9th under our current agreement. So this item is a $316,290 Black & Veatch amendment to extend those construction phase engineering services to align with the actual completion date of the contract. So this will keep Black & Veatch on site during this very critical period to troubleshoot, to inspect and look at critical path items to keep us and the contractor on task. Under the amendment, additional construction administration will be provided at a lump sum cost on a per weekly basis of $5,045 a week. And then we will pay for construction resident project engineering services to have our inspectors on site there on an hourly basis. So this amendment is structured so that we will pay for what we need, but we will have a mechanism there to have Black & Veatch on site to help us close the project out.
Go ahead, Mr. Briggs.
If there are any more delays other than what we've discussed at this time, will we have to pay Black & Veatch any additional money, or will that cover any future delays that we're going to have, either by supply chain or by COVID?
So this amendment is only for engineering related services, but it does extend their contract 6 months out. I feel very confident at this time we're going to have sufficient funds in there to maintain the presence of our design engineer on site and with us as we close it out. So I'm very confident in that.
That the 316 will take care of it?
This 6 month will take care of it, yes, sir.
Go ahead, Commissioner.
Hollis, they're going to bring we don't have a GMP on this, so there's no greatest maximum price. So the reality is, if indeed we do have another wave of COVID or supply chain, as you just suggested, yes, this could be extended. And yes, we need construction administration to carry with it. So if it goes on another month or two, we will have to pay more. That's just the reality. Frank explained it.
That is
we don't
actual-
anticipate that. But go ahead.
I appreciate that comment. We have no control. The reality of it is we have no control over the contractor finishing the project, and the way that they elect to finish the project. What we do have is we have the ability to work with them. We have a proven track record that we're all working together very well to keep the most important items moving forward. We modify our operations as necessary so that to help with moving the project forward. We have we've got our schedule, construction project schedule that we review with them on a monthly basis, and that's one of the great tools we have to help us all work together. We have our periodic payments that we make with them. We review what's been done each month, and then bring that back and all kind of review it together at our monthly progress meetings. We have strategies that we can use to identify delays and to help maintain the project and to keep it moving forward. But in the end, and that was a very good comment, I think, Mr. Zappel. Nobody can say for sure that it won't be delayed. Anything in the future is subject to what might happen in the future that we don't know about. So yes, I do feel confident that this 6 months is going to be adequate to meet the schedule that Mr. Coggins presented this morning.
Okay.
But it could always be extended
I just want to ask
I'm good. For reasons unknown to us.
Go ahead, Mr. Zappel.
Motion to approve.
Second.
All right, we have a motion and a second. All those in favor say aye.
Aye.
Okay, moving on to human resources, Mr. Briggs.
Yes, Lori, are you prepared to make any kind of statement on this? We had our meeting, human resources. We had Linda Raleigh from the county, Joe Conway from the city in reference to DE&I being presented to Cape Public Utility Authority. It was a very good meeting, and I think that we need to try and to go to the next phase of DE&I included into the Cape Public Utility Authority network.
If I might,
Yes, sir.
in your packet is the culmination of the research that we've undertaken. And as Mr. Briggs noted, there's a lot there. We received very good report outs from our peers at the city and county and our own contractor, Catapult. We received direction at the committee level to return at the next committee meeting, which has been scheduled, with a proposal for an assessment, which was a uniform recommendation from all three presenters. We also agreed that we would discuss resource needs for that assessment. So those resource needs, depending on the approval of the HR committee, would then go to the finance committee for funding via the innovation budget, is where we're at right now. Are there any questions?
From myself, no, sir. I just will reiterate, as I did in the Human Resources Committee meeting, that it does bring me a slight bit of excitement to be able to move this item forward. I think this organization, this authority, is in much need of a DE&I program. To what degree and how it will be constructed is yet to be determined. But I am excited about the movement forward of this program.
Ken, first off, thank you. I read through or at least scanned the 183 pages that were included in our packet, so I appreciate a lot of information covering nationwide as well as regional wide and crunching down to our own organization. How much is the cost for the assessment?
We're still gathering that information. We've invited back Ms. Thompson and Mr. Joe Conway to help us scope that. And that's tomorrow, if I recall correctly. And then we're going to bring that scope back to the HR committee and see if that aligns with the HR committee's expectations. If it does, then it'll go to the finance committee.
Are we looking at a 20,000, 50,000, 100,000?
I couldn't say right now. I do know that our sponsor agency spent more than that.
More than 100?
More than 20,000.
I see.
So I have heard costs from some of the larger municipalities. Remember, we've got to scale it to our
Yeah,
size.
right.
But I've heard costs that range anywhere from $50,000 to $200,000. So we've got to scale it to our needs, and I'm not prepared. I don't think we're prepared to say what that will be, but it will be manageable within our innovation budget.
I believe the city and the county both had assessments before implementing their DNI program. So will the city and county DEI officials be bringing information from those assessments and the financial reports on that to kind of get an idea of what this cost is going to be? Absolutely.
We've benefited a great deal in the very early stages of this implementation strategy from partnering with both the city and county. And we met even after our meeting to lay out some structure. So we do know that Linda and Joe are going to participate in oversight of this activity through its conclusion. We welcome that, and we're very grateful to our city representatives and our county representatives for that collaboration.
In the sake of trying to, because I know you'll have to bring back a number to this board, would it help if we had a motion to approve up to a certain amount to help move this process along instead of, delaying till another month to kind of bring that back? Say if we approved up to a $50,000 there, I'm just trying to be efficient, that's all. If we're going to move ahead with this, would that be helpful?
I'm not sure at this time because we haven't constructed the process.
I see, okay.
To take money out of the innovation fund. You do have policies that allow your executive director to expend X amount of dollars, up to X amount of dollars. I've got to meet with your finance chair and with the new chair of the board to see, all right, how do those authorities apply to the innovation fund? And we're working so hard on this. This will be one of the first examples of how we will make that a permanent process.
So the answer is no. Yeah, right. Okay.
But we're moving with all deliberate speed. We're meeting on a monthly basis with HR, and we'll do the same with finance to keep this initiative and every one moving forward.
So that vote very, very well may not come before the board, is what you're saying?
It's possible if it falls below.
Within that range, and
Yes.
that range
Yeah.
is within the innovation budget.
Right.
But we will be
What
reporting.
is that range?
I think it's 50,000.
200,000 for professional services.
And that threshold is within the innovation budget as well?
Yes. But both of these will be seen by two committees. So the finance committee will be giving feedback on that. And you can bet that I'm going to align with the finance committee's expectations.
One quick follow. And that 200,000, is that single expenditures, or is that a aggregated amount
That's a
Single.
contract amount for professionals.
for single professional services,
Yes,
up to
single
200,000?
professional
Okay.
All right, any additional questions? Human resources? Thank you, Mr. Briggs.
You're welcome.
Any old business to come before the board? No closing comments? No closed
Madam
session?
Chair,
I'm sorry, go ahead.
Just want to congratulate our new leadership
Thank you.
and look forward to a good year.
We'll be watching.
Yeah.
If you haven't been out and seen the new, all the stuff Mr. Coggins was alluding to earlier, is for a layperson like me with no engineering expertise at all, it just looks complicated and amazing. So, anyway, take advantage of it. Wear your new shoes.
Or your bird. Take a motion to adjourn then. Thank you.
I couldn't get it out of my head.
Back up and get the road, baby.
Yeah, well, I'll be following behind